Good morning, everybody. Welcome to day 22, the beginning of week 4. Rock it, you can do it. All right.
That's all you got?
That's all you said I should say. What are you still
Give them some advice. They want to hear some words of wisdom from you. No, this is all in it. This is all in it. It's outtakes also. It's intakes and outtakes. Go for it.
Okay, I have to start over again.
Go for it. This is what they like to see, the behind the scenes.
Welcome to day 22, the start of week 4. You can do it. It's better to get going than to sit still. So rock it. You got it in you. I believe in you.
All right.
You still don't like it? No, you can do it.
That's good. That's good. No, give them one more exciting. Show them an exercise. Show them your favorite breathing exercise.
Breathing exercise. Breath in through your nose. And slowly exhale.
All right, that's a wrap.
No.
Ready, go.
Good morning, everybody. My name is Akua, and I am an exercise physiologist here at the Pulmonary Wellness Center. I have been here for 10 good years. This is day 22, the beginning of week 4. Rock it, you can do it. And
Where are you from?
I'm from Ghana in West Africa. Go, Ghana!
All right.
All right.
Have a good week. Alrighty, so question of the day. Amanda says, good morning, here's my story. When I walk, my oxygen levels are fine, up to 97% with oxygen, but my heart rate is 125, and I have to stop to let the pulse come down and then walk again. So vital signs are always a hot topic of conversation. What's okay, what's not okay, and when I talk vital signs, I'm really referring to heart rate and rhythm, blood pressure, and oxygen saturation. So in order to put that into context, we must know a little bit more about you. So number one, there are certain diagnoses that are going to change your vital signs, okay? So for example, hyperthyroidism is going to raise your heart rate. Other things can raise your heart rate, et cetera, et cetera, et cetera. But the idea is that we have to look at the vital signs in context of the whole person. So first of all, the fact that your oxygen saturation is high, that's great, okay? You're using oxygen, it sounds like, okay? And that's excellent, but the question is, why would your heart rate be too high? And we don't even know, and to be quite honest with you, we don't even know if it is too high. Okay, so first and foremost, I would want to know your age. At the Pulmonary Wellness and Rehabilitation Center, assuming that all things are okay, meaning we know you don't have heart disease, we know you don't have arrhythmia, we know you don't have congestive heart failure, we will let the average patient go up to a heart rate of 200 minus your age, okay? And if you recall what we talked about in the exercise discussion, we talked about 220 minus your age being a max heart rate, but we do 200 minus your age to build in a 20-point safety zone, okay? Caffeine can raise your heart rate. Anxiety can raise your heart rate. Many medications can raise your heart rate, including the beta-2 agonist pulmonary inhalers. Theophylline is not used that often anymore, but it is an oral bronchodilator that can significantly raise your heart rate. Deconditioning can raise your heart rate. Starting off too fast can raise your heart rate. So the question is, which of those, if any, apply to you? Or is it possible that your heart rate is just high because you have little reserve when it comes to the cardiopulmonary system? Your oxygen is good. Okay, but it's not like you're going to get extra credit because your oxygen is 97%. Your oxygen is supposed to be high. So what I would suggest is this. If you're getting up in the morning and you're going to exercise, and as soon as you start walking, your heart rate's 125, I would suggest that you are starting off too quickly. So even if the workload would be okay for you under other circumstances, you may be starting too quickly, and that is going to send a signal to your body that something is not right. So in other words, if you get up and you're just sitting and doing nothing, and next thing you know, you start running on a treadmill, your body doesn't know the difference between running on a treadmill and getting chased by a bear. And so it's going to send out the troops in an effort to make sure that you're okay. Now, your oxygen's fine, okay? I don't know how much oxygen you're using, but that's a good thing, okay? Again, if you're under 75, I'm not terribly concerned by that 125. Even if you are, 125 is not super high. It's not 150. It's not 180, okay? People could have those rhythms. And 125 is not one of the rhythms or not one of the rates that kind of points us to a arrhythmia such as atrial fibrillation or supraventricular tachycardia. It sounds like maybe you're just overworking a little bit, okay? If that's the case, start out slower. Build up to your peak intensity over the course of several minutes, okay? Make sure you're doing the breathing. I would much rather you go slowly and work continuously, keeping your vital signs in a reasonable range, as opposed to go, 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 then you have to stop. Go, 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 then you have to stop. Go, 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 then you have to stop. Because if that's the case, then what's happening anyway is you're probably not that aerobic. What's happening is you're probably going anaerobic too quickly. So go nice and easy, okay? Go at a pace that's comfortable. And again, please post your age so that we can have more context on this, okay? I should have asked you for that before. But take it nice and easy, start slow, build up gradually over time. Okay, Amanda? Go lightly. That's my advice. Have a great day, everybody.